you for the introduction. Happy to be here, happy to make it, happy to be Braden's opening act this morning. And good to see a lot of folks that had a chance to meet over the years here in Arizona. Again, my name is Vincent Garcia. I work with the Phoenix Area Indian Health Service, Division of Environmental Health Services. I'm going to provide a little bit of a background this morning on our program, and also really focus on some of the COVID-19 response activities that we've been engaged in the last few months here. Just for those of you who aren't familiar with the Phoenix Area Indian Health Service structure, the Phoenix area is one of 12 national regions. Our program, the Office of Environmental Health and Engineering, consists of 5 divisions, of which the Division of Environmental Health Services is under. The EHS, we provide direct environmental health services in consultation to American Indian and Alaska Native tribal governments and Indian health service programs across the nation. The division itself has 3 sub-programs. That's the General Environmental Health Program, Institutional, and Injury Prevention. We have 5 focus areas, which include children's environment, safe drinking water, food safety, vector-borne and communicable diseases, healthy homes. Here in the Phoenix area, in terms of our program, we do have, we serve over 40 tribal communities in 4 states. We have about 2,000 facilities that we provide services to. These include Head Starts, schools, casinos, healthcare facilities, community water, wastewater infrastructure, and so forth. That work is done by about 22 to 25 full-time staff. Overall, our estimated workload is about 60 person years. So do the math, just like a lot of programs, we have a lot of work, but not a lot of folks to do it. So we're all pretty taxed, but able to do a lot of work with the resources we have still. So in terms of COVID-19 response highlights, I think that's what a lot of our programs have been dealing with in the nation and also other jurisdictions. I'm going to talk about basically just 5 key things that we've been working on. The first one is workforce safety. At the start of this pandemic, we wanted to make sure that our staff, the safety of our staff and our customers, our tribal customers, is the highest priority and still is. Some of the requests that we've received, to provide assistance with, in our communities include fit testing healthcare personnel and emergency responders for respiratory protection for N95s. So our team, and this is across the Phoenix area, not just within my district, have been doing that. So we have my counterpart, Landon Wiggins, Commander Landon Wiggins in the Reno Sparks area, Nevada, and then Commander Sarah Snyder, who covers the eastern part of our state. Been working a lot, very hard on providing these kind of services. The second piece to this is, we've been engaged in what we would call virtual or distance assessments. Our priorities have shifted to mission critical activities the past 7 months. We've had some travel restrictions, which basically, still allows us to get out in the field, particularly when there's mission critical work involved, related to COVID response or investigations or requests, specific requests from our tribal leaders. In response to that, we wanted to make sure again that the safety of our staff and our customers, our clients, was a high priority. We went ahead and developed a guideline, named it the Phoenix Area Guideline, conducting field visits during COVID-19, guidance for our division personnel. to help staff respond safely to requests. So that guideline outlines key steps, decisions to make before we send our staff out in the field. This piece is virtual. Many of our tribal programs are required to provide workplace safety training to staff. We're one of the key providers to those, to meeting that need. So, since we can't really, we had some limitations, in terms of travel, our staff, put our heads together, developed and updated multiple training modules, such as the OSHA bloodborne pathogen, hazard communication, infection control, injury prevention, food safety, and then COVID-19 basics. Put that all in a package, sent it out, distributed it to our communities, and then held, over 20 sessions to date, and that's a conservative estimate. 20 sessions delivered virtually, resulting in over 500 personnel trained across our 4 states here in the Phoenix area. So very, very successful endeavor. Technical assistance. A lot of the work that we've done since, again, since March, has involved, even though we aren't able to really get out in the communities, especially at the start of this, we wanted to assure our tribal leadership, our program managers, our enterprises, that we are, that we're still here, we're still working, we're still able to provide services. And boy, did we ever do that. We had so many reopening plans that our staff, reviewed, provided feedback on. Within our program, we generated and disseminated multiple types of guidances based on the CDC's best practices, and also the American Industrial Hygiene Association and other credible entities like EPA. Lots of reopening plans. Some of the things that we looked for in these reopening plans were what type of, verifying cleaning and disinfection chemicals, particularly the disinfectants that were being used by our establishments, make sure that they are on the EPA list N of approved disinfectants for COVID. So we were able to help guide our program operators along on that. Secondly, we reviewed a lot of the workplace safety policies, such as what do they have in place as far as physical distancing, safety barriers, hand hygiene, and employee health plans. And finally, the last piece to this response, it's been all hands on deck here in the Phoenix area, and also, really throughout the other 12 areas in IHS, in terms of folks, being engaged in emergency response and operations. Our leadership and our staff have, are actively engaged in incident command activities, either on a regional level or a local level. A lot of our tribes, stood up incident command, and so officers like Lieutenant Hickey and our counterparts have been actively engaged in any assistance that we can provide to the incident command teams. For example, we've been involved in local response initiatives, such as testing, COVID testing, screening of patients and staff coming into healthcare facilities. And I mentioned earlier, respiratory fit testing for essential personnel. And lastly, deployments, as commissioned officers, as I said, it's been all hands on deck. We have had officers across the nation deploy to various locations to provide support to the response efforts involving the U.S. Public Health Service. One of our officers responded to early on, went to Texas for 30 days and did assisted with some testing over there. Lieutenant Hickey here will be heading out to one of the communities, one of the tribal nations sometime this winter to assist with deployment involving water infrastructure for one of the bigger communities. So that's my update. I know that's a lot to digest. There's be happy to answer any questions later on. I'll put my phone number, contact information on the chat. But now I'll go ahead and turn it over to Lieutenant Hickey for her presentation on playground safety. Thank you.
Good morning, everybody. My name is Braden Hickey, and I am a lieutenant in the U.S. Public Health Service. I currently work for the Indian Health Service in the Western Arizona District. And today I'm just going to talk to you a little bit about a project I completed on playground safety. During my presentation, I'm going to be talking about the background of my playground safety project, as well as the different project components listed there. And I also want to talk a little bit about the next steps after the completion of the original 2-year project. As I mentioned earlier, I work for the Indian Health Service, and I'm stationed at the Colorado River Service Unit, which is located in Parker, Arizona. And we provide comprehensive environmental health services to 5 tribal communities along the Colorado River. And our program has 3 main areas, which includes the general environmental health, which is going to be your basic food inspections, pool inspections, vector control, those kinds of things. We also have an institutional team, and they provide technical assistance to our healthcare facilities. And we also have an injury prevention program whose goal it is to reduce injuries and injury-related deaths in Native American communities. And this is the program that my playground safety project fell into. Why playgrounds? Why focus on a playground safety project? Well, we typically in our program do inspect playgrounds if they're associated with a school or a child care center or Head Start, but public playgrounds located in communities or subdivisions are typically not inspected by us. And during some field work that we is part of our normal routine, we actually had noticed that several of the public playgrounds were in pretty poor condition, and some of those are pictured here at the bottom of the slide. So we had thought maybe, a good project to work on would be assessing all of our playgrounds and trying to get some of these repaired so that there is a safe environment for the kids to play at. And it actually aligned also with our national environmental health focus areas, one of which is the children's environment. So it really aligned nicely with our national priorities. To give a little background about playground safety and playground related injuries, each year over 200,000 children visit an emergency department for a playground related injury. And as I'm sure you can gather from your own personal experience or your children's, that a lot of injuries happen on playgrounds, and a lot of them don't visit an emergency department. So this is really just the tip of the iceberg as far as playground related injuries go. Unfortunately, there have also been several deaths associated with playground equipment. Between 2009 and 2014, there were 34 deaths that were investigated by the Consumer Product Safety Commission. So there may be more than those 34. 2/3 of reported injuries involve falls or playground equipment failures. This is actually valuable information for us because this shows that if we make sure the equipment is maintained properly and that we have adequate fall surfacing, we could potentially reduce the number or severity of injuries related to playground equipment. The goal of the project was to reduce playground-related injuries within the Colorado River Service Unit. By first assessing each of our playgrounds, we were able to locate 28 total playgrounds within our service unit. By also providing a report of the findings to each of our operators and developing training tools and resources for the operators as well as the environmental health officers. As we began to plan out the different project components, it really evolved into 5 main areas or objectives. The first was for myself to complete a playground safety training. The second was to develop checklists and resources to provide both the operators and fellow environmental health officers or inspectors. The third was to actually assess or inspect all of the playgrounds and provide a final report and resources to the operators, and also to look at the next steps to create a sustainable playground safety program. The first thing I did was to seek out training opportunities for playground safety and playground hazard assessment. And I was able to find a pretty comprehensive training from the National Recreation and Park Association, or the NRPA. And it was an online course consisting of 4 different modules: playground surfacing, playground equipment, identifying hazards, and public playground risk management. It approached playground safety in a general way, meaning that it was applicable to all different types of playgrounds and all different age groups. And that's one of the reasons why I chose this specific training. Other trainings that I had found were more geared towards a specific age group, and I wanted to be able to apply this training to all of our different playgrounds at all of our different facilities, regardless of the age group. So after taking these online modules, I was able to pass the Certified Playground Safety Inspector exam, which is good for 3 years. All the information that I'm going to talk about today is either from the Consumer Product Safety Commission's Public Playground Safety Handbook, which is on the right there. It's that purple guidance document, or from the ASTM standards that the National Recreation and Park Association included in their training. So there are several ASTM standards associated with play equipment, and I should make a special note that this is only for public playground equipment. The equipment that you might have in your backyard or in a private residence has different standards than public play equipment. So these standards are specific to public playground equipment. One of the most common comments that I got, or feedback that I got while explaining the project I was working on, was that children just get hurt on playgrounds. It's just something that happens. Children are going to be running around and tripping and falling and crawling all over it and running into each other, and they're just going to end up getting hurt, and that's just the nature of things. And in some sense that is true. There are risks with playground equipment and different pieces of equipment depending on the different age groups. But I guess I just want to talk about the difference between a risk and a hazard. So a risk is a learning experience where the child makes a choice, and it allows for the growth of the child both physically and socially. And these are things that we want them to experience. We want them to take risks and to grow in that way. However, what we don't want is a hazard. A hazard is an avoidable danger that a child does not expect. So it's going to potentially be, running and getting their shirt caught on a bolt that's protruding, or getting their head, hitting their head on that protruding bolt. It could be running in front of the swings and getting hit by one of those metal animal swings that we talked about. So a hazard is something that we really want to remove from the playground. So that is the difference between a risk and a hazard. So all hazards must be removed from the playground area. Here are some of the general playground hazards that you might see on a playground. So you can have really anything from a burn, especially out here in the Arizona sun, and if it's metal play equipment, for sure. A burn, trips, wood rot, metal corrosion, sharp edges. So really there's a lot to look at when you're assessing a playground. There's also a list of prohibited equipment that is no longer allowed on public playgrounds. That includes those animal swings that you can see pictured here. So those are extremely heavy, and ended up acting basically as battering rams. So when a child was running past one of these swings and got hit, they would become seriously injured. And I believe that some children even died from being hit by these types of swings. So those animal swings are no longer allowed on public playgrounds. Some other pieces of equipment that are no longer allowed includes trapeze bars, multiple occupancy swings, trampolines, exercise rings, and swinging gates or doors. While we're talking about the different hazards on a playground, there is one thing from the National Recreation and Park Association training that they really emphasized, and that was being able to classify these hazards so that the operators know the types of things that need to be corrected immediately and the types of things that you can wait on a little bit. And it's the same type of concept when we do our food inspections, right? We have higher priorities and more, walls, floor, ceilings, things that aren't necessarily high up on the list. So we have a listing here, priorities 1 through 5. A priority 1 is the highest severity of a hazard. So it could cause a permanent disability, a loss of a body part, or death. And that hazard should be corrected immediately. We also have another type of hazard, or priority level 2, which is the potential to cause serious injury, and that should also be corrected immediately. So 1 and 2 are considered our high priority hazards, things that need to be corrected as soon as possible. Our priority level 3 are going to be minor or non-disabling injuries. So it could be a scratch from a protruding bolt, things that cause an injury, but not necessarily something that is going to be causing a disability. And those types of hazards should be corrected when time permits or when resources permit. Priority level 4 are going to be things that if the condition worsens, it's going to be a problem. So this is something that a playground operator can do proactively, is address these priority 4s so they don't result in an injury in the future. And finally, we have priority level 5, which means that they are compliant, meaning that there is not a deficiency. However, it's not following the best practices, if that makes sense. So a good example of this, especially here in Arizona, is not having a shade over the play equipment to protect it from the sun. So it's not a requirement that play equipment has a shade. However, it is a best practice. So that would be a priority level 5, meaning that if the facility has the resources to do so, that it is best practice, and they should try to do that, try to correct that priority level 5 if possible. Let's talk about falls first. So as I mentioned, fall surfacing is one of the most important things that we can do to reduce the severity of injuries on our playgrounds. There are 2 types of fall surfacing. The first one is called loose fill, and that's pictured on the left. That's going to include our basic mulch, shredded rubber, pea gravel, and sand. We also have a newer type of fall surfacing that's pictured on the right, which is called unitary fall surfacing. And that's basically just going to be a tile, a rubber tile, or poured in rubber surfacing. It's a little bit more expensive, but it is much easier to maintain than the loose fill. So I want to focus a little bit more on the picture on the left, which is the loose fill, looks like wood mulch type of fall surfacing. Does anyone know what depth of fall surfacing you should have on your playground? It actually surprises most people. It's at least 9 inches of loose fill. So that's a 9-inch depth of mulch or sand or pea gravel. Now, you can tell here in the picture on the left that there is definitely not 9 inches of loose fill. The whole point of the fall surfacing is to absorb some of that impact from the child falling and hopefully reduce the severity of the injury in that way. So you can tell here there's also an exposed concrete footer. That's especially dangerous if a child were to fall and hit their head on that or hit their arm on that. That would likely cause a pretty severe injury. And the last thing I want to talk about with fall surfacing is fall height. So a piece of equipment's fall height is the tallest play surface that a child could fall off from. So for a slide, it's going to be the top of the slide. For a swing, it's the distance from the top of the support beam all the way down to the fall surfacing. So those are considered the fall heights. So different types of fall surfacing protects up to a different height. So for example, we have 6 inches of shredded rubber protects up to a fall height of 10 feet. So you could have a piece of equipment that has a fall height of 10 foot installed above shredded rubber. On the other hand, if you have sand, you need 9 inches of sand, and the maximum fall height for that is 4 foot. So you could not have any piece of equipment that's taller than 4 foot installed over sand. I see this a lot with swings, is that a lot of times swings have sand as a fall surface. Unfortunately, since sand only protects up to 4 foot, it's never protective enough to be used with a swing. So swings are almost, I've never seen a swing shorter than 4 foot. So a swing should really have a fall height of probably at least 7 to 8 feet, maybe even more than that. So you need to be looking at installing shredded rubber or wood mulch or wood chips for swings. Protrusion is another hazard on the playground that should be removed as soon as possible. It is likely a priority 1 or priority 2 on the hazard classification system. A protrusion is a part that extends beyond the equipment surface, and you can see some examples on the right of bolts that are protruding beyond the play surface that could cause a child to be bruised or be scratched. They can spike, pierce, stab, enter an eye socket, or bruise internal organs. They can also be entanglement hazards, which are a concern if clothing catches on them. And the way that we determine whether it is a protrusion, we use those projection gauges that are pictured at the bottom. And so basically you just take one of those, you place it over top the bolt or whatever projection you're looking at. If that projection extends beyond that second surface of that gauge, it's considered a protrusion and it needs to be removed. Or for example, if it's a bolt, it can be shaved down so that it's no longer extending out so far. Going along with that, we have entanglement hazards, which are pieces of equipment where a child's clothing could catch on. So the most common one is probably the open S-hooks on the swings, which is in that middle picture. So if you have an open S-hook as pictured, where clothing could get lodged between the metal pieces there, and if a child tries to jump off a swing, the clothing is going to yank them back. The clothing is going to get caught in that open S-hook, and it could yank them backwards and be a strangulation hazard. The same concept is with the metal slide there. The slide bed has slightly detached from the slide wall, and as a child goes down the slide, their clothing could get caught in that gap and be a strangulation hazard. We also have head entrapment hazards, which is where a child can basically fit their body through a gap in the play equipment, but their head cannot fit and then they become stuck. So on the upper left picture, the silver gauges, the one on the left is a torso gauge, and that is supposed to simulate the size of a small child's waist. The circular one on the right is a head gauge, and it's supposed to simulate the size of a large child's head. So the idea is that if you can fit the body or the torso gauge through the gap and not the head gauge, that means the child's head could become stuck, and it is an entrapment hazard. So any opening that is between 3.5 inches and 9 inches wide should be removed or somehow eliminated from that piece of equipment. And it's more common on older play equipment before 1991. New equipment has to meet the ASTM standards. However, I have seen newer pieces of equipment or newer playgrounds that have been put together improperly, and that's when these gaps could occur. And here's another photo of just what a head entrapment looks like. So you can tell, especially the picture on the left, the child has slipped their body through that gap, but their head is stuck and they cannot reach the ground. Their feet are dangling. So it is another strangulation hazard where they are just hanging from that gap. And that's why these types of things should be remediated or corrected immediately. Finally, one of the other high priority hazards is crush or shear hazards. And those are openings created by moving play equipment. So like suspension bridges or rotating swings, or here we have pictured one of those steering wheels with gaps where a child could stick their arm through that gap. And if another child yanks the steering wheel, could cause a crush. It could cause them to be pinched or crushed. And the way that you tell if something is a crush or a shear hazard is by using those silver gauges at the top, and they simulate a child's fingers and even arms. So using all of this information, and particularly looking out for those high priority hazards, the 1s and the 2s, we were able to assess all of the playgrounds within the Colorado River Service Unit, totaling 28 playgrounds. 11 of them were private or limited access playgrounds. Those are located at schools or Head Starts, and they have a little bit more oversight than the public playgrounds, which we were able to locate 17 public playgrounds. To look at some of the results, here are the average and median for our assessments and what we found. So we found an average of 8.9 deficiencies per playground, and with a median of 8 and a range of 2 to 21 deficiencies. Looking at specifically the high priority findings of priority 1 and 2, we found 2.9 on average per playground, a median of 2, and a range of 0 to 10. There was quite a large range, so you can see that some of the playgrounds are very well maintained and other ones really have a high number of deficiencies. I also wanted to look at what the most common findings were to see if there were any trends during looking at the results from our assessments, as well as looking specifically at the high priority findings and then looking at the public versus the private playgrounds and comparing them. Here is just a quick chart on the most common deficiencies that we noted. So every single playground we inspected, all 28, had missing documentation. And documentation is important just to make sure you have a historical record of your playground, what types of injuries occurred, how you addressed any deficiencies. Also, you want to maintain equipment spec sheets just so that you are aware of who to contact if you need to repair it or how you can repair it properly yourself. Another high priority finding was the inadequate fall surfacing. So 86% of our playgrounds had inadequate fall surfacing, which is very high, and something that I wanted to look into a little bit more, since that is one of the main ways we can reduce the severity of playground related injuries. 79% of them had equipment in poor repair, 64% are missing signage, and 57% had no shade canopy. These were the top number of deficiencies that we noticed during our assessments. Also wanted to look at our total number of deficiencies by priority number. So 12% of our deficiencies were priority 1s, 21.8% were priority 2s, and then the majority were priority 3s, which, if you remember, priority 3 was you can correct that time permitting, so when you have the time and resources to do so. The priority 1s and 2s are the ones that need to be corrected immediately, so those are definitely the ones that need to be focused on more. I was also curious to see what percentage of playgrounds had high priority findings, which are those priority level 1 and 2 hazards. So we looked at the inadequate fall surfacing, and 86% of our playgrounds had inadequate fall surfacing. 18% had head entrapment hazards, 36% had entanglement hazards, 32% had protrusion hazards. So these are those ones that really should be corrected immediately, and it just shows that there is a lot of potential for severe injuries on many of the playgrounds that we looked at. And finally, I just wanted to compare the public playgrounds with the limited access playgrounds. I had hypothesized that our public playgrounds would have a higher number of deficiencies and a higher number of high priority findings, just because there is less oversight and less management with a public playground than with a playground at a school or a childcare center. But as you can tell, there wasn't a huge difference, and in fact, it was not statistically significant. And one limitation could be just the small sample size. There were only 28 playgrounds that we looked at, with only having 11 of the private or limited access playgrounds. Additionally, it's difficult to take the size of the playground into account. For example, you might have one playground that is just one play structure, one slide perhaps, and then another playground might have 10 different structures. So there's just a lot more opportunity to find deficiencies on the playground that is larger than a smaller playground. After we completed the assessment of each of the playgrounds, we provided a comprehensive report to the operator. We also made sure to include the hazard priority classification for each of the items that we noted, so that the operator was able to see how severe the hazard was and what the time frame was for correction. I also included in my report a copy of the playground risk management packet, which I'll talk about later in more detail, but it basically provides a pretty broad overview of everything that they can do to make sure that their playground is a safe and healthy environment for the children. I also offered to meet with each operator to go over the findings and to provide training to their employees or other people that might maintain the playgrounds. So now I just want to go over just some photos that we saw and kind of just look at some of the different hazards that we had identified. So here is, both of these are protrusion and entanglement hazards. So you can tell the picture on the right there, that white circle is one of those gauges I had talked about. So you can tell that definitely the bolt extends beyond the surface of the gauge. So that is a protrusion hazard. And the photo on the left is a DIY kind of repair where they needed a more circular washer and they did not have it. So they used that rectangular one, which presents sharp corners, and also a child's clothing could easily get caught on that. So that's a good example of something where they tried to repair the equipment, but it just wasn't done properly and actually probably presents more of a hazard than it did before. Here is an example of inadequate fall surfacing. You can tell there is definitely not 9 inches of loose fill on any of these photos, particularly the photos, the photo on the left and in the middle. They have metal portions of the play equipment that's exposed that a child, if they were to fall on that, would probably be severely injured, especially if they hit their head. So those are things that should be covered with 9 inches of loose fill. Here's another head entrapment hazard, and as you can tell, this is the newer piece of equipment. It's a pretty new playground, and I think what had happened here was just improper installation, like I'd mentioned before, where it was just not put together properly, and so a head entrapment hazard became apparent when you could see the torso gauge can easily fit through that gap, whereas the head gauge could not, leading to a head entrapment hazard. Here's another photo of a DIY repair where they had a circular washer. It was just extending beyond the surface a little bit too much, and this is the top of a slide. So there is a lot of potential for a sweatshirt or other type of clothing to get caught around this washer, and as a child goes down the slide, to cause strangulation. Here is a good example of a zip line, which is a fun piece of equipment for a lot of children. However, they installed the ramp backwards so that if a child were to start going down the zip line and lose their grip and fall, they would fall directly onto this ramp and potentially, break a bone or have a traumatic brain injury or something of that nature. So additionally, there is no fall surfacing. So this is all just a grassy field type area. So they would definitely need to install either the unitary fall surfacing or get some of the loose fill so that if a child falls off the zip line, they have some type of absorbent material they would fall on to. Here's additional examples of inadequate fall surfacing, particularly the photo on the upper right. Those animal rockers are very close to that wooden structure. So if a child were to fall off backwards from the animal rockers, they would hit their head or their back on that wooden structure, and that would be a severe injury. So really any play equipment should have at least a 6-foot radius around it where nothing else is there so that the child has room to fall and not be injured on another structure. I don't want to focus just on the deficiencies of all the playgrounds because there were also some very nice playgrounds that were very new, and this is a great example of one. And, you know, this is a playground that was installed very recently. It has the unitary fall surfacing, and it's very expensive though. I believe that this playground cost over $250,000. So that kind of brings me to another part of the project that kind of came out, and it was not only to help operators identify deficiencies in their playgrounds, but also how to help them maintain the equipment so that it stays in good shape. It doesn't, you know, it doesn't weather quickly and it lasts a long time because it is so expensive to repair and to replace. So the longer we can get this equipment to last for, the more the children can enjoy it and be safe on it. Finally, I just want to talk about some of the resources that I was able to develop during this project. And the first one was a playground inspection checklist. And that was basically just a list of the items that I would look for when I would go out into the field. And I had it with me so that I didn't forget to check anything off the list. The second was an inspector quick reference guide, which was helpful when you were out doing a playground assessment and you needed to check something that you were unsure about. You could refer to this guidance document, which is pictured here on the lower left corner. And it was just a one-pager of basically the most important things to be looking for and some reminders as far as which types of fall surfacing were protective for which heights, and different things in that nature. I also developed a playground risk management packet, which is pictured here on the right, and that was provided, like I mentioned earlier, to each of the operators and kind of gave them an overview of the different types of things they should be thinking about for their playgrounds and how to make sure that they're kept safe. And finally, it developed some training PowerPoints, both for the operators and their staff, as well as for other playground inspectors within the Phoenix area. Some next steps include continuing to provide training and technical support to our playground operators, and additionally, cross-training our other Phoenix area environmental health staff on conducting playground assessments. I want to also start to expand the project and look at other playgrounds within the Phoenix area, and if possible, do follow-up surveys of our public playgrounds just to see if there were any improvements since the previous year's inspection. COVID has kind of thrown a wrench into that plan just because of us being restricted on our travel and our field activities, but I'm hoping to be able to at least do one follow-up inspection of each of the playgrounds. I also wanted to look more into grant and funding opportunities for our tribal communities since it is so expensive to build and maintain these playgrounds. It would help provide them with some tools to make sure that the children are playing in safe environments. And that concludes my presentation. I have a QR code up here that